confusion about what the core actually is. Is that right?
I think there's a lot of confusion, not just a little, to be really
Yeah,
honest.
I'll second that. Yeah.
I think, yeah.
It's not just the superficial muscles, is it? It's.
Oh gosh, no. I believe, and I think Shira will be able to explain this much better than I will, but I'll give it a go. I think women focus just solely on their abdomen sometimes and how flat they can become really quickly, and that's really not our messaging. We're wanting women to really focus on not just their abdominals but their pelvic floor and their back muscles, because in my humble opinion they all work synergistically, and if they're not working together you're not going to potentially get the desired result. Shira's obviously an expert in this area.
So I agree with your humble opinion. It's actually backed up by research, so you're spot on. It's really important that women do work the abdominal wall, but unfortunately there's become a sort of confusion in terms of which abdominal muscles to work. We certainly don't want to be working the external abdominal muscles early on in pregnancy at all, and early in the postnatal period. What we do want to work on is the deep abdominals, the deepmost layer. So I like to think of it as almost like a water bottle. Where's my water? There it is. So the core muscles are not just your abdominals, they're actually, this is your core. So your whole body functions essentially around the core. So it's got 4 components. 1 is your deep abdominals, which are at the front. 2 are your deep back muscles at the back. The top is your diaphragm, so your breathing muscle, and then the bottom of is your pelvic floor. So you really need all 4 components to work together in harmony in order to have effective movement, in order to prevent those issues we talked about before in terms of abdominal separation, where you get protrusion out the back, in terms of back pain, too much pressure at the back, in terms of leakage. If you can imagine, if I took that lid off, if the pelvic floor is not functioning, then there's a dysfunction in that whole canister.
And I can imagine running wouldn't be a good idea, especially if your pelvic floor is weak early. Early
So we need to make sure and restore function in that core muscle, in the core muscles, before we take the intensity up a notch.
So are there any sort of tips, things they can do at home that they, when they're wearing their recovery shorts?
Yeah, absolutely. So the pelvic floor exercise, which we've done before, but just getting your deep abdominals to work in early motherhood is a really good idea to support your back and get your abdominals to close and give your pelvis more stability. So to get those muscles to work, let's all do it. So get one hand under your lower abdominal, and one hand to your lower back. Sit up nice and tall, let your muscles relax and let them go. And then very gently and slowly draw your front hand towards your back hand. So you're very gently, about 30%, pulling in. They're your deep muscles, they're your natural corset for your back. Keep breathing, of course, Sinead. Sarah.
Hold your breath.
And then release. So working those muscles in isolation to start with, and then we can advance them. Anytime women lift their baby, pick anything up, switching those muscles on.
I was about to say that I'm quite conscious of that whenever I pick my kids up, to make sure I'm switching all that on and not hurting your back.
Excellent. So that's a good start, starting that early in pregnancy and certainly throughout pregnancy and into the postnatal.
And if you feel like you need some more information or support, contact your women's health physiotherapist for an appointment, and jump on srchealth.com to order your pair of recovery shorts.